is awesome. All right, and they set up all the chairs and the tables and the sound equipment too, but their weather prediction also excellent for us. So, hi everyone, it's Mandy Cohen. How are you? We're good. How are you? All right, we're here for a celebration. It's Employee Appreciation Week, and we wanted to just make this all about celebrating you, celebrating the hard work of many folks, and people will continue to stream because when you say the word pizza, then folks show up. But before we get to pizza, we wanted to talk about some of the great work that's been happening over the last number of months. Now, we haven't done as many all-staff meetings as I have wanted to because we've been heads down doing a lot of great work. So we have some things to catch up on here. But before I get to it, for those of you who remember other staff meetings, I have some special prizes for folks again because we're going to talk about our values. So Hattie, who's my special assistant, who's amazing, has a bunch of chocolate bars right there. And who doesn't love chocolate to go with your pizza? All right. Who can name one of our DHHS values? All right. We got whatever. Joy, our favorite value. Woo, Joy. What's your name and where do you work? Controller's office. Woo! All right. Who can name me a second value? There's 6. Stewardship. Yes. Stewardship. Where do you work? Another control. Oh, ringers from the controller's office. A third value. Transparency. I love it. Where do you work? Okay, Kirby Building. Woo! Okay. All right. Another value. Accountability, not one of our values, but I love it. You're getting chocolate for that. I love accountability. Yes, yes. Okay, over here, back there. Customer service, yes. Focus on the people we serve. Absolutely. 2 chocolate bars for that one. Nice. All right, so we had customer focus. I've heard transparency, stewardship, and joy. We have 2 more. Proactive communication. Give everyone over there a chocolate bar. Yes. Teamwork. Yes. That's our. Gosh, guys, I am so proud. Do you remember our last staff meeting where I basically had to beg someone to take the chocolate out of my hands to remember our values? So excellent job, all of you who studied up on our values. All right. For the next person who can get 5 chocolate bars, who can name all 6 at once? Who wants the microphone? Who can name all 6 at once? Come on. Oh, here we go. Sorry, Facebook people, I'm walking. All 6. Here we go.
Teamwork, customer service, transparency, no, consistency, no, a little. I'm sorry. I thought I have them. I don't know. Any help? Teamwork. I said teamwork. Yeah. I'm sorry.
Excellent team effort. Joy. All right. These ladies over here need some chocolate bars, but thank you. It's hard to take the microphone. All right. So it's a focus on who we serve. It's proactive communication. It's teamwork. It's transparency. It's stewardship and joy. And we make a game out of it, but those values mean a lot to our work. And I am so proud of us living our values every day. And that's what we're going to talk about before we eat pizza here, is living those values and how I am so proud of our team being extremely focused on those we serve. We have a lot of changes going on, but also a lot of need out there. And I'm so excited that when we did our employee engagement survey, 100% of respondents said, I understand and use my values in our daily work. I understand our values. And thank you for that. Thank you for living those values every day. But it's really good to remind ourselves of those, focus on those we serve, that proactive communication, the teamwork, the transparency, the stewardship, and of course, today's about joy. So we have a lot to celebrate, but I just want to highlight a couple of things over the last even just a couple of weeks here that's been at the department that really exemplify living our values. So, for example, last week it was amazing. We launched it's Older Americans Month. That's right, Aging and Adult Services. Thank you. It's Older Americans Month, and they did they launched the month with a terrific celebration of music and art and a lot of joy. And we even had the Silver Diva and Dudes do some amazing cheerleading for us. And it was embracing that joy, but also remembering that it's a month to recognize that there's many older Americans in our community that need our help. So it was that combination of joy and teamwork and focus on those we serve. Then in February, I had the honor of being part at Cherry Hospital. For the first time, they had a huge celebration about Black History Month, and those in the African American community that have contributed to the success of Cherry Hospital and treating those of us who have mental illness. So it was an incredible event. And again, a lot of teamwork and communication and focusing on who we serve went into that event. They even had all the folks from who were residents at Cherry Hospital join in on the event. It was a really wonderful event. And then I also wanted to recognize the Office of Minority Health. We had Black History Month as well. They started a series of chat and chew so that we can start to really dig in on some really hard issues around equity and the fact that we have a lot of work to do to make sure that we are striving towards that equity in who we are serving every day. And then we further, our leadership team had a session around really trying to understand racial inequities and not seeing them as individual acts of meanness, but rather things that are systemic, and how do we really understand those? So great leadership by the Office of Minority Health and Cornell Wright and Mark Benton and others who are really elevating that conversation. So again, about that proactive communication, that transparency, it starts with understanding what we are doing and looking at our data to really get at some of those inequity issues. So really, really great stuff. Okay, now I'm going to turn it over to some of our deputies who are going to talk further about some of our amazing milestones, and I can already smell the pizza. So we will be quick, but thank you all for living our values, and I'm going to turn it over to Dave Richard from Medicaid to start.
Thank you, Secretary. So we will be fast because we smell the pizza, but good morning, everybody, and happy Appreciation Week. We're excited to be here. As the Secretary mentioned, you know, we have high priorities in the department. One of them is the Medicaid transformation, and as I want to start out, transformation requires teamwork as we're working. So I know that there are people here from every division, and I know that in our work around Medicaid transformation, we're touching every division inside the department, and people have been raising their hands, standing up to do that. So one of those values about that teamwork is really critical. And as we think about all of transformation, we think about all of those values, and I'll mention a couple as we walk through it. But I want to talk about a few of the key milestones that have happened since we've had our last all-staff meeting. One is that I know you know that our waiver was approved back in October, and that waiver, as approved, is a groundbreaking waiver. We're doing some incredible stuff different than what other people across the country are doing inside of Medicaid, and we'll talk about a couple of those things. But it's a very exciting time for all of us to really think about the people we serve. That's the key to this waiver. It's about the people in North Carolina who receive Medicaid, but also others who need improved health in North Carolina. Since then, we've had a bunch of key milestones. One of the most important ones is that in February, we awarded to 5 health plans the contract to do Medicaid managed care. Those health plans, you've seen all the information going out, but it was a big deal. But before that, we had to have a team of folks that were across Medicaid that actually had to read the RFPs, the 400 plus pages, plus all of the other addendums, and come up with those recommendations for those health plans that not only were the best health plans in North Carolina we can go forward, but could withstand the kind of protest and scrutiny that we're getting. And so we're incredibly proud of the work that folks did. Let me say that those people on the team had to raise their hand to say, I'm going to take this opportunity to really participate and take 3 months out of my life to do that work. We have demonstrated the commitment to proactive communication, which is what we all talk about by doing a significant amount of communication to the field. We need to do more, but face-to-face regional meetings, webinars, we've had over 15 already, 20 plus more planned. virtual office hours where providers and individuals can come in and talk to our staff, and PHP, those managed care meet and greets across the state. And then we're doing an awful lot of work about our beneficiary engagement, and that's where we need all of us to be a part about that. Really people-focused, making sure that we are providing the information that folks need. The fact sheets that we're providing, working on our call centers for people as they come in, and initiate and making sure that we have the right addresses for people down to that level to make sure that people get there. And then I really want to mention the Healthy Opportunities work. There's a ton of folks across the department that are doing that, really rest in the Secretary's office, but is a critical component of our Medicaid waiver. And if you think about anything of what we're doing in North Carolina, changing the way that we think about health to really address the issues that aren't just healthcare, but are the social determinants that we all know are so important in the lives of people, is what we've been focusing on. So the federal waiver approved $650 million of expenditure authority for pilots that we have in Healthy Opportunities. But really important is over the past several months, NC Care 360 launched and is now in 5 counties across the state. This is an incredible partnership with the department and private folks, along with all of our health community, to really change the way we think about healthcare in North Carolina and health. So there's an awful lot of work we've got to do. We're all going to continue to ask you to help us do that work across managed care, because it is a departmental initiative and it is important for all of us to achieve that. So we look forward to that teamwork, transparency, and important communication that we'll be doing in this work. And then I'm going to turn it over to Cody to talk a little bit more.
Hi, everybody. How you doing? Good. So don't worry. My goal is to talk just until the pizza gets cold, and then you can go eat. Okay. So I think everyone knows that combating the opioid epidemic has been a top priority for our department. And I'm sure that all of you, as both employees here and as members of the great state of North Carolina, you've been impacted probably personally and professionally by this epidemic. And it's been a huge effort across the department to respond appropriately. And I think as we look at that response, we see our values front and center, right? First and foremost, we see teamwork, right? It's been incredibly hard to think about how do we really turn the tide on this using every tool we have across every division that works together to get this done. Second, stewardship, right? We've got a limited set of resources. We have a huge need. We've had to think creatively about how to address that need as efficiently as possible with the resources we have. And then, of course, proactive communication. How do we make sure folks understand what's going on, what we're doing, and how we're responding to it? So I just want to go through an amazing list of accomplishments of what we've done so far to address this epidemic and continue to keep us focused on the work. So first and foremost, we've been committed to reducing the oversupply of opioids. We've trained over 3,000 prescribers on how to do their work better and how to make sure they're responding to the opioid epidemic. We've launched multiple education campaigns that you've probably seen on TV. And overall, the results are real. We've seen a 15% decrease in prescriptions, which has been huge, and also a reduction in the number of days that people are prescribed opioids, which has made a difference, because the number one way that people are still getting access to opioids is through meds in other people's cabinets that are unused. The second thing we've been doing is rolling out our controlled substance reporting system that's been a part of that puzzle as well. And I think most know that the team worked to actually roll this out in the middle of the hurricane, and it actually rolled out seamlessly, and it was very smooth, and that's a testament to all the planning that went into it. 61% of prescribers and dispensers are currently using CSRS. 40% of them are using it on at least a monthly average. This has been a huge collaboration with the IT folks, with the folks at DMH, with the folks at DPH across the entire organization. We've got 119 healthcare entities across the state that are in the process to integrate their EHRs with the controlled substance reporting system, which means that as the prescribers log in, they're going to see this data at the very front so that they can make good decisions on what they're prescribing and have good data-informed conversations with their patients, people-focused. We've also continued to do our NARCS Care product, which is helping visualize the data so that people can really make wise decisions quickly and they don't have to spend a lot of time trying to digest it. Okay, I'll move on. So we also know that we have two major challenges in really turning the tide. One is access to care, and the other one is having a provider base for treatment. for individuals that are living with substance use disorder, and in particular opioid use disorder. We've received $54 million from the federal government to help impact that treatment. That money has gone to care for about 12,000 people. That's 12,000 uninsured individuals in treatment that would not have gotten care without those resources and without that coordinated effort. We just got another $12 million to that effect, and we continue to provide that support in our communities. We've done direct grants to local communities. 34 local communities have received various grants. We now have medication-assisted treatment in an inpatient setting at all 3 of our drug and alcohol treatment centers that the state operates. And we continue to push forward on expanding access and expanding treatment. But we know there's a lot more to do. We know that people are 40 times more likely to die after they leave jail or prison in that first 2 weeks, most likely because of an overdose. And so we've just recently announced pilot programs with 2 reentry facilities and 2 jails to help get folks into care before they leave jail or prison so that they can transition back into community well and safely. And we need to continue to expand those pilots across the state. And we've been in conversations with 3 additional counties to build that capacity out at their jails as well. So there's a lot of work underway there. So we've also continued to stand up a research agenda to make sure that we're really tracking our data and we're understanding how this data impacts the choices that we're making and shaping our strategy. But we have a whole lot more to do still. We know that 450,000 North Carolinians are living with a heroin or opioid use disorder. We know that more than half of the people that show up in the emergency room are uninsured. More than half the people that show up in an emergency room from an overdose are uninsured. And so that's a huge number of folks that we likely need to be serving. And so we keep pushing forward there. And we all know, I think, that expansion is going to be a huge part of that puzzle in trying to get people more access to care. So I just want to applaud the hard work that's happening here. It's in the face of a huge challenge. People are being creative about using every tool that they possibly can. And I'm sure that we'll keep marching forward on that work. Thank you so much every day for everything you do for North Carolina. And now it's my privilege to hand the mic over to Deputy Secretary Perry Manning.
Hi, everybody. I'm Susan Perry Manning. How are you this afternoon? Good. Well, how many of you a few weeks ago might have been here for Dreamville Fest? Any Dreamville Fest goers in our audience today? All right. Well, I don't see no takers. I'm surprised. All right. So, sir, you know that J. Cole was here, right here on this very campus just a few weeks ago. I spent some time this morning practicing Crooked Smile by J. Cole. I was going to sing it to you all, but I'm feeling too shy. I can't do it. So instead, I am actually going to say Happy Employee Appreciation Week to everybody, first of all. And on that note, I do want to make a special thank you to Amanda Parks for organizing this staff meeting and the incredible admin team. Thank you for all you do every day for our team. And then I'm going to just talk just for a couple minutes because I am now what is standing between you and your lunch about our early childhood action plan. And I'm not going to do what the secretary did, and I'm not going to ask you to name the 10 goals that are in the Early Childhood Action Plan, but I think there's still a few chocolate bars left. I've got 3 questions for you to make you connect to early childhood and our Early Childhood Action Plan. So first question, who here can tell me how many neural connections are forming every second in a baby's brain? 200,000. Anybody else? Higher. Who said, did you say 1 million? You're from the controller's office, aren't you? You're getting a chocolate bar because, yes, over 1 million neural connections form per second in a baby's brain. Okay. Second question. What is the single biggest predictor of high school graduation? Anyone? Anyone care to hazard a guess? Oh, somebody, did I hear? Reading level, yes. End of 3rd grade reading achievement level is the single greatest predictor of you. Where are you from? Medicaid. Medicaid gets a chocolate bar. Thank you. Thank you very much. So Many of the reasons we're focusing on early childhood is because so much of early brain development and the foundation for future success in school and in life and in health really happens in those early childhood years. So I have one more question for you, and it's one of the 10 goals on our early childhood action plan. We have 10 measurable goals that we want to achieve by 2025. And one of them is around the disparity in the infant mortality rate among African American babies and white babies. Does anybody know what the disparity rate is? If you are a black baby in North Carolina, the likelihood that you will die is how much higher? 2 to 1? 40%? 2.5 times more likely than a white baby to die in the state of North Carolina if you're a black baby. So that is why it's one of our goals in our early childhood action plan. So if you haven't taken a look at the early childhood action plan, I encourage you to do that. And I want to celebrate teamwork and proactive communication around the development of our early childhood action plan, because we had folks from Medicaid, from public health, from mental health, from aging and adult services, from child welfare services, from the Division of Child Development and Early Education, all across the department coming together and really working hard on what is going to make the biggest difference in a young child's life and really set them on the path for success and for long-time health. And what are those goals and how can we work to achieve them? And we had incredible groups of people working across all of our divisions on that. And we just launched the plan in February with the governor, who hosted a summit, and we are already starting to see progress on our plan. I'm really excited to announce that thanks to some good work, we are going to be a state that has the biggest online presence of Triple P, for example, thanks to our public health folks and our folks in social services for working on that initiative. We have legislation to increase the level of education that an early childhood teacher has who works with young children. It passed unanimously out of the House this last week with unanimously bipartisan support for that bill. So we're really excited about that. Our NC Cares 360 platform and the Healthy Opportunities work that's going to help folks get access to resources they need across our state. So we're already seeing momentum on our early childhood action plan, and that's the result of the incredible proactive communication and teamwork across all of our teams here at the department. So on that note, I think I am closing down the house. I am letting you have your pizza on behalf of all of us. Happy Employee Appreciation Week. Sincerely, we are so grateful for the hard work that you do on behalf of the people of North Carolina every day. It makes a difference. Keep doing the good work and have a great time. Thanks.